Hello, everybody. You're welcome to Dr. Abayomi Ajayi Live. My name is Dr. Abayomi Ajayi. Yes, today is Mother's Day. We'll be with our mothers. Anyway, but also we wish the to-be mothers too. You're related to being a mother. Don't forget that this is the month of March. Though there's so much coloration this month, you all know. Endometriosis today. We're going to be talking about how you can become a mom or how you can become a mother even when you have endometriosis. That's what we're going to be talking about today. Well, endometriosis is the condition where you have tissues like the tissues that line the uterus, what we call the endometrium. This is part that the woman sheds every month. That's called the endometrium. Okay, and that is what you see. That is the part that is shed every month. Now, when these tissues like that appear like this also are present in any other place apart from is very common, but it is often misdiagnosed. Actually, it's said to be the second most common gynecological problem just after uterine fibroids. Uterine fibroids undisputedly is the most common thing, gynecological problem, but endometriosis has some problems. Diagnosis is late. In fact, in the UK, it is said to be between 4 to 10 years. There is a 4 to 10 years delay from the onset of the symptoms to when diagnosis is made. Now, but why is diagnosis that can be missed or delayed? In the process, the patients are usually mislabeled. They're given a different diagnosis and, of course, mistreated. Some have been labeled, especially in this environment, to have tuberculosis made. But why is this diagnosis often made or delayed? And the reason is simple. Symptoms are usually non-specific. And then again, in Ireland, that it's a disease for Caucasians. And so doctors were not thinking of endometriosis in this climate at all. But now we know that from studies that have been done in places where, for example, like in Chicago, where blacks and whites cohabit, we've seen that the incidence of endometriosis, you will ask me, the hallmark of symptom is pain. This pain usually will affect the quality of life. So you can see some of these people, they have been mislabeled as being groggy, usually with their menstrual period. So they have very painful menstrual. Like I was saying, this pain could be with the menstrual period. So you could see some people, their menstrual period, it's a hell. All right? Or like other women who just have their menses until you are told that I'm menstruating, you don't know. I'm not saying that all of them have endometriosis, but it's something we need to look out for. But in some people, this pain is just there. For some people, the pain only comes when they have intercourse. All right? It's very excruciating pain sometimes. It usually makes the pain that comes with endometriosis worse. All right? And one thing about the pain from endometriosis is that it tends to get worse as you grow older. It doesn't get better. The other thing is that sometimes these people, or sometimes it's just they can't just time it. Some people can even bleed from their lips. Some people will bleed from other places, maybe in the vagina, but not from the uterus. Okay, and in fact, in this environment, because up to very recently, most of the people who have endometriosis have learned. Now, you ask me, how does endometriosis affect fertility? Let me say, although endometriosis has the potential to reduce fertility, it is not everyone that we have. People who have endometriosis that have infertility. In other words, 50 to 70. Sometimes it's very difficult for us to fully explain how fertility is affected. But one thing we know, that when you have endometriosis, it will take you a little bit longer to achieve conception. And the part that looks like the endometrium in other parts. So it can be on the ovary, it can be anywhere else. But you know that every month that you bleed, that's why your menstrual period is usually symptomatic. If you have it on your ovary, it means it's like you are bleeding inside your tummy. So when you have blood in your tummy, what is going to happen is that after a while, you form scar tissue. And therefore, all the organs that are supposed to be adjacent to each other causes some of this pain that you have with endometriosis. And that also can cause infertility because there will be loss of the relationship between once this anatomy is distorted, then you can also have infertility. But also, beyond that, because you are bleeding into your abdomen, the blood is not just blood alone. It also, don't forget, it's not unusual for these chemicals to have effect. And we know that infertility is often related to the severity of the disease. So, the disease also is graded to mild, moderate, severe. And in Wakaife, Inyobonge Jelogu, Adam Wachuku, Grace Inyamuwa Omo. Thank you very much for joining on Facebook. On Instagram, Kemi Olawoye. So, like I was saying, that this infertility is usually related to the severity of the disease. Well, why this is so, but we know that that's been shown by many studies that the risk of miscarriage might be higher in people who have endometriosis. But one thing also that we have also noticed, that the risk of ectopic pregnancy may also be higher. You have a pregnancy not in the uterus, but in a different place, most commonly in the tube. So usually because and continues to grow and becomes an ectopic. But that is not all bad news, because when you get pregnant with endometriosis, sometimes this tends to help endometriosis. It's the things that we said was that many years ago also, that maybe pregnancy could cure endometriosis, but we now know that the progesterone is dominant rather than estrogen, and so sometimes progesterone can give you a very good feeling, So sometimes the symptoms become better. May also help with the symptoms of endometriosis. As you know, that when a woman is breastfeeding, there is no ovulation, or ovulation is suppressed. And that's why you can have what we call the ovulation also does not occur. The growth of the tissues that normally, we say that endometrial tissues is reduced, and so pain and cure endometriosis. Now the question is, we're trying to get somebody who has endometriosis pregnant. How can you improve your chances of natural conception? Normal thing, healthy lifestyle. See, we need to re-emphasize all the time that we are what we eat. And it's very important, if you're going to be healthy, especially, you must eat food that is rich in fruits, vegetables, whole grains, and lean protein, but not less than 3 times a week. Aerobics or walking, it's okay. We're not saying become a marathon runner. If you can, it's okay. Starting your family. Usually, we advise that you don't stay longer than you are 35. But that will be egg freezing. Okay? So if you don't have a partner, or you're approaching about 34, had multiple surgeries. By the time you're going to have a second, a third surgery, because sometimes I've seen patients with endometriosis who have had 13. Please also consider to freeze your eggs, because as they module around the ovaries, the blood supply can also be modeled. Okay, and then there's something we call, if you have on both ovaries, it is better for you to affect the quality of eggs over time. All right. So even whether you've had surgery or you've not had surgery, so you can imagine if you've had 2-3 surgeries, please, you must consider freezing your eggs. Okay. So then, if you Well, for you, even when you are below 35, if you have tried for 6 months, when you know that you have a diagnosis of endometriosis, you don't have the luxury of waiting for a year. And like I've been saying, like the pain is unbearable, but even by the time you're doing a second or a third, for somebody who has endometriosis. Now, for someone who already has a diagnosis of endometriosis or did ART, actually, drug treatment for infertility, pain of endometriosis, yes. But in order for you to get pregnant, drugs do very little on. So the two options are usually surgery or assisted reproduction. So age is one of the things that will be determining whether you're having surgery or you're having IVF. Then it will also look at the tubes are open or not. Then also it's going to do what we call ovarian AMH, anti-malarial hormone, or we're doing the 3-FSH. All right. Probably we want to know what your uterine cavity looks like. Is it normal or is it abnormal? Because you might have to do a hysteroscopy if it's not normal, or if it's usually indicated in minimal or mild disease. But you are better off when you are less than 35 years to consider surgery. For people, think also that usually swings in the direction of surgery is when you have water in the tubes because of the blockage. There is already water in the tubes. Now, what we say is that 6 to 12 months, if you are still not pregnant, then you should be doing assisted reproductive technology. So it's, like I said, you have either or. Either you're doing intrauterine insemination plus insemination. Most people will do IVF. For you to qualify for intrauterine insemination, there are things you need to be aware of. Because you have almost a 50% reduction in pregnancy rate from when you do IUI in the presence of endometriosis. But even for you to qualify for, your husband's semen parameters must be good. Preferably you are less than 35, like I said. But after doing 3-4 cycles of cool, if your tubal function is already compromised, you've done HSG, the tubes are blocked, then you need IVF. If you're over 37 years old, you need IVF. If you have done 3-4 IUIs that have failed, you need IVF. If you've cyst present, it's advanced disease, it's a stage 4 disease, and therefore you need IVF. Now, endometriosis, So, I'm going to take a question and then come back to my is endometriosis hereditary? We were talking about that, and even IVF in the face of endometriosis might not be a tea party, okay? Because just like we said with that, though now the last study released by the American Society for Reproductive Medicine shows that there is no negative effect of endometriosis. What we have seen is that if you're doing IVF and you have endometriosis, that the dosage of the drugs that you will need might be more than somebody who does not have endometriosis. We also have seen that you might produce less number of eggs when you compare to somebody who does not have endometriosis. The quality is where the jury is still that there is a higher incidence of cycle cancellation in people with IVF, with endometriosis. A pregnancy outcome is poorer in people who have advanced disease, especially when there is ovarian involvement, the endometrioma or chocolate cyst that I spoke about, or when there have been repeated ovarian surgery. Or for this, there have been some things that have been advocated to take care of all the problems I've highlighted. And one of them, we first started with, before we do IVF, with surgery BMI. Anytime we see anything, we want to chase it before we do IVF. But we have seen that if you continue either before you do the IVF or before you do your transfer, I think the transfer is more important. We do give you the drugs before the transfer. And these drugs actually are drugs that reduce the inflammation, because that inflammation is global, it's everywhere. And so we need to reduce that inflammation in order for even the endometrium to be able to work better. So we usually use some conditions. If you have this endometrioma that is so big that is not going to allow the doctor to be able to get the eggs, if you have pain that is so severe due to this endometrioma, then it's better that that is sorted out before you do your IVF. Really, that cancer is suspected, then it's better that surgery is done and you take a sample to the laboratory to see endometriosis is that. Counseling is key. You know, don't forget that we said there is a high risk of explain to you even before you start. And then also, frozen embryo transfer might be beneficial for me before I go. So I'm going to conclude on this, trying to conceive with endometriosis. So I would say that when you want to conceive as you fear, okay, but because there are ways out in this, many people with endometriosis have had their own children. Don't forget that you can do conceive spontaneously. Now, I just want to spend the last few minutes talking about the myths, some of the myths that surround endometriosis. Many believe that it's normal. Please, if you don't take anything from this program today, severe menstrual pain is not normal. Go to your doctor. Use that. No one is too young to have endometriosis. Many people think that endometriosis only comes in your 20s or your 30s. That might just be what might help them before all the things that can go wrong really go wrong. And then again, maybe I need to say it again, that there is no cure for endometriosis. So pregnancy does not cure endometriosis. Hormones don't cure endometriosis. In fact, hysterectomy, removing the uterus, does not cure endometriosis. But on a brighter note, I also like to tell you that, like I've said before, that having endometriosis, of course, COVID-19 has taken everything. We cannot match this year. But we'll be having an endo. You'll be hearing some live testimonies from those who have had this disease, as well as from experts. Foundation to be a part of the hangout. Anyway, you will see everything on my Facebook page, all the information that you need in order for you to be able to be part of this. The government is trying a lot to see what we can do. But I guess there's so much more that we can do. Let me tell you something about this COVID. It's like, I wrote some things on my Facebook. Better just get it straight. It's microbes versus man. The microbes are not, like we say in Nigeria, they are not joking. It's better we get our acts together. I think we might need to be able to help ourselves. I think private hospitals should be able to more test kits. The government, we can't leave it to the government alone. We might have to look for how to fund some of these things. We know that, but what we are seeing in other parts of the world, our medical services, our facilities in Nigeria cannot handle anything. And I know there are two ways. It's either you are making diagnosis early to benefit from medical services, or you are waiting for everybody to become positive, and then we weigh down the non-existent medical services. The choice is ours. But I think it's something we all need to see what is happening in Spain. They're losing about 800 people every day now. You don't want that to happen to us here, do we? So please, I think we have brain. So they shouldn't beat us to this battle. I leave you all to think about this. So I'll see you in 2 weeks. I know that's not part of my beats. So I'll see you in 2 weeks. Well, I'm just concerned about how we're losing this viral, everything about how it's going on my page. So thank you very much for being a part of this. Please keep safe. Wash your hands. Actually, let it become like a... Don't shake.